Osteoarthritis, OA, is a degeneration of the joint. There's about 3 million cases per year. The joint itself becomes inflamed. You can have one joint on one side, you can have another joint on another. It doesn't have to be equal on both sides. Pain and stiffness is the biggest thing that most people feel initially. It will get worse as you get older. It can also be called degenerative joint disease or just wear and tear of the joint. The cartilage that lines that joint is breaking down, and as that breaks down, one part of the joint comes closer to the other part of the joint because there's no protection between the two. And when that occurs, as one bone gets closer to the other, friction occurs, and then there's breakdown more. So not just the cartilage or cushioning, but also the bone itself. Other things can occur, such as some spurring, where you'll see excess bone formation in the joint, and that will also cause pain. Symptoms of a general arthritis are stiffness. Usually that's worse in the morning. People will complain when they first get up that they're pretty stiff. As they move around a little bit more in the morning, it will start to feel a little bit better. Decreased mobility or range of motion. You won't be able to move the joint quite as well as you used to be able to move it. Clicking, popping, sometimes catching and cracking. People always say it almost sounds like Rice Krispies because of the noises that the joint makes. And also, if you're younger, more pain with increased activity level, as well as more pain at the end of the day. Incidence of arthritis occurs mostly as we get older. The biggest decades would be between the 60s and 70s. The other things that can also predispose someone, if your family has a big history of arthritis in the family, then you will be more likely to have that. Also, congenital defects. So if you were born with poor alignment, if you were born with a dislocated hip, they also call that hip dysplasia. If you have rheumatoid arthritis, sometimes trauma, like from a motor vehicle accident or some kind of injury, how physical therapy can help. So with arthritis, people need to understand that there's no cure for that, and the thing that we need to work on is giving that joint a good support system. We need to address any weakness that is around the joint. So strengthening all the muscles around the joint will give that joint the support system it needs, and will take the brunt of the weight that it bears through the actual joint off, because it now has other things that can help it. So the more we can strengthen those muscles around the joint, the better you will feel in general. There are other issues in your body, musculoskeletal wise, that can cause the same kind of pain. So when you go to see a physical therapist, we can figure out what that pain is coming from. So where that pain is coming from exactly. The back can radiate pain to your groin and thigh. Your sacroiliac joint can also do the same. So we need to figure out the actual source of your pain, and physical therapists will be able to figure that out for you. We can also prescribe specific exercises based on your presentation. So some people are weaker than others, other people have lost more mobility in the joint than others. So seeing a physical therapist will be able to see what exact exercises you need to do in order to improve the mobility and strength in your joint.